Well, let's talk about the people in in Parliament, who are trying to actually demand the evidence from the government before we do see the planned new tiers come into force. Prime Minister is going to announce this afternoon around 3:30 in the Commons what's going to happen at the end of this lockdown. But the COVID research group, now numbering 70 backbench Tory MPs, say yet again they want to see the cost-benefit analysis for any change. Steve Baker is one of these MPs and leading them and joins us now. Good morning to you, Steve.
Good morning, Julia.
Good morning. Well, you asked for the cost-benefit analysis, the impact assessment report last time. You didn't get it. 34 Tory MPs, 38 MPs in total voted against the lockdown move. You've now got a lot more MPs, especially now they know that they were lied to about this 4,000 deaths a day nonsense, which was spouted before the lockdown. Do you have any hope of getting any sort of impact assessment, any analysis from the government?
Well, I should say we have already had some successes. We've been working collegiately with the government, as I hope your listeners would expect us to. You know, I provided ministers last week with a list of things that we were especially concerned about, which appeared in our letter. Things like the 10 p.m. curfew, outdoor sport, gyms. I should have added swimming pools, of course. Also retail, all retail that's COVID safe. I think we believe doesn't spread the virus. So we gave that list to ministers. That list has been trailed out as areas where there's going to be relaxation. So, you know, we have already had some success. There's no question that the government will get its way because Labour will vote for authoritarian measures. So our task here is to hold the government to account, as it were, since Labour aren't, and to make sure that we do say, you know, if you're going to restrict people's fundamental liberties, you need to show that it helps contain COVID and that it does more good than harm, because the government's own assessment of the first lockdown showed that in quality-adjusted life years, adjusted for comorbidities, the first lockdown did more harm than good. So we can't go on with this cycle of lockdowns.
Well, indeed. And again, that quality adjusted life years, I mean, this has been the basis for virtually all healthcare spending for decades. This is the idea that in terms of, you know, what action you take and what you spend and how many actual added years of life do you get in total. And the reality is we know that COVID, very tragically and very sadly, and no one is saying that older people or sick people's lives are not worthwhile. No one is saying that. We've all got older relatives, grandparents, parents, but very, very, very elderly, very, very sick people dying a couple of months earlier than they might otherwise have done is a tragedy and sad for them and their families. But it is a greater tragedy and a greater sadness if we are looking at years and years of life, of healthy life, taken off far, far, far younger people for decades and decades to come. And that is the reality of what lockdowns do.
I'm afraid that this is a very difficult conversation to have, but we really need to be clear about the harms on all sides. And it is a complex optimization problem. So, for example, if COVID gets too high, that can squeeze cancer patients out of hospital. So COVID, in a sense, harms cancer patients. And we shouldn't misclassify that. But it's also the case that people won't go to hospital sometimes because they wrongly fear going. People should go to hospital, but sometimes they wrongly fear going to hospital when they've got cancer or they've had a heart attack or a stroke or whatever it may be. And that also drives up the incidence of those killers. So it's a very complex optimization problem, but it's one the government should be facing up to. It's not enough to have used the models you referred to them. That quite clearly we can see from leaks to the BBC that the Prime Minister was shown two terrifying charts, one about deaths, modelled deaths. That's proven to be untrue. People can look at how actual deaths are progressing against the projection by looking at data.spectator.co.uk. And the other one was hospital capacity projections. And given that the chart itself says that it takes about 3 weeks for non-pharmaceutical interventions to have an effect on hospitalisations, in a couple of regions, the NHS should be overwhelmed by now, and it's not. So in both cases, the wheels have fallen off that modelling, and we just can't go on with poor quality modelling like this, determining all our lives.
But we're constantly told, but if it wasn't for the lockdown, we would be overwhelmed. And again, as you pointed out, those effects were felt. Sometimes the infection rates were actually in lots of places were already going down just from the tiers. They were going down in tier 2 before people were put in tier 3. They were going down before the lockdown. Those effects could not possibly be felt by now, as they already are being felt, if it was due to the lockdown. They simply couldn't. It is a logical impossibility.
last Wednesday, we were briefed out as MPs. It was Chatham House, so I won't name the person who said it, but we were told that it would take a little over 2 weeks for the lockdown to appear in the case numbers. And I hammered the point and said, when will you see in the case numbers the effects of lockdown? And it was this weekend just past. So I think we can say with some certainty now, and I'm holding in my hand a report prepared by professionals on the subject, that the peak of infections occurred in the week before lockdown nationally. That cases overall and in the over 60s were stabilising nationally in the week before lockdown, and so on. I've just retweeted my friend Dr. Raghib Ali, who's written about this. The reality is we were over the peak before lockdown started, and this really has to raise serious questions about the basis on which decisions were taken, the basis on which the Prime Minister was undoubtedly bounced, and why we've had our liberties so constrained.
But should we excuse the Prime Minister of having, a lot of this information is out there. He can search the internet. He can listen to different experts. People like Carl Hennigan were brought in twice to see him to give opposing points of view. The reality is this is a government that is being led by basically focus groups and polling, which says that after scaring the living daylights out of everybody, understandably last March and April, that people have stayed scared. The numbers are being wheeled out every day, hundreds and hundreds of people dying, and we're not placed in any context. And the government is basically reaping the benefits and the cost of that fear factor, unless or until the public says, up with this, we will not put anymore. This doesn't make sense anymore. We're going to take sensible measures in our own lives to protect our own loved ones and others who are vulnerable. We are going to carry on in and out of lockdown, aren't we?
Well, in a sense, I agree with much of what you've said, but in a sense, that's what we're doing in the COVID recovery group. We're actually giving voice to this set of concerns, and we're trying to do it in a collegiate way, knowing that we can't defeat the government in any votes and that we're Conservative MPs and we wish to be helpful. Yep. But I have to say, a lot of this, you really can't lay on, the blame does not really lay on the Prime Minister. There is a really fundamental structural problem with the way science is being handled. SAGE has been put on a pedestal and people have talked about the science as if there was a single view. You've named Sunetra Gupta, Carl Hennigan, there are others. I've worked with both of them. Clearly, anyone can see with access to social media that scientists disagree, particularly in the interpretation of data which is uncertain. So what we should have is competitive expert advice, multidisciplinary teams with what I would call devil's advocates or red teams to challenge their advice. And the Prime Minister should have 3 teams of competing experts on a decision like this, because what we've got instead is monopoly expert advice. There's a lot of pride involved once decisions have been taken. Of course, it's the job of the government machine to get its way with the public, and things have become actually sometimes quite frightening. So I think we need to treat the public like adults. I think we need to treat scientists in a proper manner. We need to stop asking the impossible of them. And all that means competitive expert advice, no more bouncing the Prime Minister with modelling that turns out to be wrong. You do have to ask how many times do models have to be wrong before ministers say this cannot go on. So I've published a paper written by an expert in the field, and I'll be presenting that to ministers, I hope, this week. We've just got to fix the modelling. We've got to fix the expert advice. If we do those 2 things, the Prime Minister will get better advice and we won't be stuck in cycles of lockdown like this.